Good job. Hey everyone, it's Mxiety. I am on tonight with the lovely Dr. Jessi Gold. We are going to be chatting about COVID, about how it affects our mental health, how it doesn't affect our mental health, what we are going to expect in the long run from it, and then probably everything else, as long as I'm also breaking technology. So basically everything you've come to expect from an Mxiety stream. Yeah, absolutely. Yes. Okay, so let's go. Dr. Gold. Should I be calling you Dr. Gold? Because I kept referring to you as Jessi.
I'm okay with whatever.
Okay. All right. Well, I'm okay with you being okay with whatever you want it to be. Okay. So, can you introduce yourself and tell us about your background?
Sure. Hi, I'm Jessie. I'm a psychiatrist. I do outpatient psychiatry primarily. I see like college students and graduate students and healthcare professionals in my practice. I live in St. Louis. I work at Washington University in St. Louis. I'm an assistant professor there. I also do like what you do in academics, so research and writing. I do a lot of popular press writing where I write about the intersection of mental health and popular culture and about ways that we can destigmatize mental health and think about how to talk about mental health on greater platforms. And I write for, like, I'm a contributor for Forbes and I write for Self pretty regularly and some other places too.
Awesome. 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 So what brought you into psycho? Like, why do what you're doing? What happened?
What happened to me? This is really deep. You know, well, how long do you have? Um, I was always interested in science, so I thought I was going to go to medical school. And when I was in college, I was really interested in not the regular science classes and was interested in anthropology. Ended up being an anthropology major, really liked the intersection of like public health and global health and medicine. And so was really trying to figure out how to do like writing and really liked the humanity part of medicine. When I took a year off in between med school, before med school, I did some global health stuff and some public policy stuff, and then went to med school and was like, I really like the brain. I really like people, but my dad's a psychiatrist, so I'm not going to be a psychiatrist,
Of course.
which
Right.
is like very classic. And so I tried really hard not to be a psychiatrist. I did all the neurology interest group stuff. I was like trying to be a neurologist and was just not a good fit for me. I did neurology research. I really, really tried. And I was just really drawn more and more towards psychiatry. Like every person I met did like some kind of career that balanced a bunch of different things. Nobody really had like an in the box career. Didn't really feel like they were trying to fit you into a mold, which was really nice for me. That was like the only career where you really had like time with patients still, which was really nice. I felt like in a lot of medical fields, which I'm sure you guys know, going to the doctor, like you get really rushed out, and psychiatry is really still like you get at least like 30 minutes or an hour when you go see someone. So that's like actually surprisingly long. um, so that was really nice, and really got to spend time learning people's stories. And for me, it was like if I'm going to see like 100 people with depression and 100 people with a stroke and they're all going to have maybe the same treatment in the end, like what do I really want to hear and what am I most interested in? And it was really like I really like people's how they got to be who they are and what brings them to be like depressed, right? So it's like everybody has a different reason, but maybe the treatment's the same, but that doesn't really matter as much as like how we think about them as a person and how they got to be there and how we can help them in the long run. And so that's like,
Right.
I mean, that's like kind of how I got there.
That's awesome. You made it sound like it was going to be the longest story on the planet.
I
That's a great,
I
yeah.
I shortened it for you.
Okay. Well, it was a great summary, and I personally find that kind of stuff interesting because people, like you said, nobody gets into any field that they're in by just perfectly like falling into a box. Like I don't know many people that are like I went to study this and then I did that for 60 years. Like that's not really a thing that happens anymore. Yeah. All right. Okay. Cool. 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 So, obviously, are you still a practicing psychiatrist, or do you mostly do all the? You are. Okay. Interesting. Okay.
Yeah, I see patients like 60-70% of my time.
Oh my God. Okay.
Yeah.
I assume that like your writing and everything has taken over, but I also know how much writers get paid, so I probably shouldn't assume that ever.
I think also people assume that because I write a lot and it doesn't make sense with how much I must be also seeing patients. So then you kind of put the time together and you're like, you obviously have no life, but it's actually the have no life part, not the I don't see patients part.
Got it. Okay. So you either don't sleep or you see patients. It's just you gotta pick one. Yeah, well, it's
Yeah,
the greater good, so it's fine if you don't sleep.
exactly.
Oh my gosh. But this is also coming from somebody who has a 9 to 5 live streams, also writes. So I really like this is definitely pot calling the kettle black kind of situation. I'm laughing at you through my own soul. Uh, so in terms of psychiatry, you've probably seen a huge shift in how you interact with patients, right? And I want to start there. I was as anybody I guess as just about anybody who has access to the magazine, I was reading the Psychology Now article, Psychology Today, got it, eventually, article about the fact that like there's a huge paradigm shift in how therapy works because teletherapy is pretty much the only way you can see a therapist now. So I was wondering, have you felt in your practice, has that felt like a huge difference or has that been kind of seamless or?
No. I mean, and not at all seamless. I mean, I've been seeing people online via telemedicine since March about, and that's really different. I mean, when I went through training is only like 2 years ago. I'm not that far out, and we barely learned how to do telehealth. We did like one rotation that had a little bit of it, but really everything's humans, like people. And I'm a big people person. I'm an extrovert. It's really different. I mean, I think psychiatry and therapy, all mental health fields are pretty lucky in that the transition compared to other fields of medicine is significantly easier. We don't
Right.
have a physical exam in which we have to say like, "Hi, can you touch your own belly and tell me how your belly feels today?" Because
Right.
that's really hard, right?
Right.
We don't
Right.
have to do that, which I think is like a bonus. But I think what's really hard is like when you're talking to me, like you don't really see my hands. I have to show you my hands. Like for the most part, you're really just seeing my eyes and my face. And
Right.
I don't really get like as I don't feel as connected. I'll tell you that. Like I
Okay.
think you miss some of that. I think you miss some of the nuances of behavior. I think we learn a lot from seeing people's like whole body and how you shift and how
Right.
you interact when you're talking to someone. And I also think you shift back and like talk back with your body in the same way. So
Right.
I
Right.
think
Right.
that it's kind of hard to explain, but I think that without that, I feel like you're not as connected. It's harder to like respond empathetically and respond with the same techniques you might have before. So like if someone's crying or something, like you're sort of like I use a lot of talking, right? If like I see that you're crying, I'm usually would maybe pass like a box of tissues or something, but
Right.
I can't do that through the
So that
screen.
little
So
empathy piece is missing.
yeah, and like sort of subtle empathy, right? Like tissues to me, like when I was a med student, someone was like, just literally always go get the tissues or make sure there's tissues in the room. And it was something really subtle for me, but it really made a big difference. And I've always been really aware of that. And that to me is really missing. Like I can't say like I've actually tried over a telehealth, like if I was in the room with you right now, like I would be getting you tissues. And it's so awkward. Like it's not
It's
good.
not the same. Yeah, no.
Not the
Telling
same.
somebody, listen, if I was there, you would definitely have tissues right now. But yeah, I guess you have to use your sleeve. So too, and I'll watch you do that. So too
It's
bad.
super awkward. And, I think, for me, I mean, you can tell I use humor a lot. And I think it's, it works, but I think it works better if people already know me and I have less of a chance to break the ice with Zoom and like other forms of video. So, like, when you let people into the waiting room, they sort of just like pop up on the screen, sort of like we did, right?
Oh, right.
Instead of like you walk them from the waiting room and you can like ask them about the weather and like kind of talk about something that's
Transition.
not mental health and like
Right.
make it easier. And then they kind of realize you're actually just a goofy person and you're not being weird. And then, so if you try to do that to break the ice in the Zoom, it's just weird. So you kind of just start right in and it just is different in that way too. I would also say the frame is harder to keep. So like, when you go to your therapist's office or you go to your psychiatrist's office, every time, start and end on time for the most part, like quiet, same look of the room, almost like sterile in a way, a
Right.
little too like, it depends on how your therapist is or how your
Right.
psychiatrist is. It's sort of like hippy dippy in some places, like, they like certain things, right? But I think but so predictable, right? But like for me, like at home, my dog's here. Like on Thursday, there was somebody cutting the lawn, and so like there was a leaf blower the entire time, and my dog barked at the person through the window, and so every single session, like my dog was barking and the leaf blower was going, and I was like, today is a bogey. I'm really sorry. Like it's a bad day. Like I can barely hear you. I'm really trying. You're gonna hear my dog the entire time. I'm gonna mute when I'm not talking. You don't have
Right.
to.
Right. There's a lot
But
of
like,
other distractions other than just
and
being
it
one
just,
on one.
yeah, and it doesn't, I mean, it just doesn't feel as safe a little bit. And I think it's the same on the other side, right? Like a lot of people are trying to find space in their house that's quiet or like where the person they're not talking about, like if you go to therapy to talk about your spouse, your partner, or whatever, and they're
Right.
home, like you got to go
Right.
somewhere else, right, where they're not. And so I feel like a lot of people have been like talking from their cars or like driving somewhere and parking and then talking from there. And it's fine, but it's like really awkward to sit in
It's
your
not
car for an
ideal.
hour,
Yeah.
right? Like not normal, like not a typical conversation to like talk to someone on a video for an
No,
hour.
no. And I've
So
I've been the person that I remember I called my therapist for like like I texted her and she's like, "Okay, call me now." And I was driving and then I started hysterically sobbing. So I was like, "Oh my God, I got to pull over into the first place because I can't be driving like this." So I pulled over into a parking lot and I'm sitting there crying and talking to her. And this guy comes over and knocks on my window and he's like, "Ma'am, are you okay? You're not supposed to be here. This is a valet lot." And I'm like, "Are you kidding me?" Like, so
you're
yeah.
like, I'm busy. This is my therapist. I'm fine.
This is fine. You're gonna have to wait until I leave, and that's gonna be when I decided it.
You're like, I have 25 minutes left, you know? But yeah, I mean, it's really different. I mean, in that way, it's really different. I mean, I think the benefits of like this is going on 6 months now. Like,
Yeah.
imagine what that would be for people if we
Wait,
hadn't.
you said is that right? Because we
I counted. It's bad. Don't do it. It's
just
bad.
wait, wait, because that's 6 months, fam. That's a lot of time. Hold on. Oh my God, my head hurts. 6 months. And Google's talking about the fact that like they're not going to reopen until next summer because that's when they predict that like the vaccines will be available and stuff. So
I mean, just imagine though, like if your therapist was just like we didn't have this, right? Like
right,
I mean, that's horrible. So like we're really lucky in that sense
right,
that we have something, and we're also, I mean, I think a lot of my patients that don't have to drive think it's like fantastic. I mean, I
right.
have patients that used to drive. Like we're in St. Louis, like it's a big city, but like a lot of like Missouri is pretty rural and a lot of Illinois is really rural. And they drove here from like 2 hours away to come here because there weren't other psychiatrists, right? And so they
Wow.
don't have to do that, right? Like they don't have
Right.
to drive like 2 hours to see me for 30 minutes to check in about medication, right? They just go on the computer. Like that's fantastic, right?
Right.
Like I would love that if I was them too. Like it might not be ideal, like in terms of the conversation, but like it is so much better than 4 hours of commute for like a 30-40 minute conversation,
It
right?
is.
So I think that's a big, big, big benefit.
Right. Well, and that was kind of my time is like super tight. So that's one of the things that I do like about the fact that because I would ask my therapist to do like Skype calls all the time and she'd be like if you can, I'd really rather you come into the office. And I totally get it. It's different and everything, but now I'm like, "Ha, I can't come into the office." I win. Because
I've been
yeah.
begging I've been begging my therapist to let me go into the office. I'm like, so like when you let like one person, it's gonna be me, right? And she's like, I've heard you the first 17 times when you said that. And
I
I hear
know.
you every time that you say that you hate working and how work is always on the computer, like that you would like work to be in person. I also know that we're also on the computer. And she's always like, I hear that statement and I will take that into consideration when I am making my plans. which are not changing anytime soon. Which I'm like, okay,
Just
I respect
politely, I
the,
hear you, but like, no.
it's like, as a very nice, like, reflective no. It's like, I hear you repeatedly telling me that work would be better in person, and this is also not in person, but I can't change that for you. So sorry.
Do you find so you kind of you talked about body language, and I think that that's the weirdest one, because a lot of people, I mean, part of the reason I went to therapy, so I'm going to generalize saying a lot of people, is I couldn't name my emotions for my life. So like my therapist would be like, what are you feeling now? And I'd be like, sad, happy, grumpy, frumpy, I don't know, like all of them at the same time probably. And she's like, well, there's probably one that we can like nail down here. And she kind of would get to that through my body language, right? So do you feel like you kind of have to pull that out of patients more now, like really nail down, like, what are you because I can't tell exactly how you're feeling because there's a screen in between us. So what are you feel like, is that something that you worry about?
A little bit. I think it's harder for sure. I mean, a lot of people have that problem with words. That's why they even like have that feelings wheel, and people are like, "Why did you just give me a wheel of words? Like, I'm not five," but it is
No.
really
Yeah.
helpful,
Yeah.
right? Like,
Yeah.
once you get it, you're like, "Look at all these words that I didn't know were words," and And I have a lot of patients that are like, "It's annoying," and they say annoying a lot, or mad, because I see
Yeah.
a lot of college students,
Sure.
and you're like, "Is it annoying?" And they're like, "Did I do it again?" Like, because
Yeah.
that's the only word that they know, is like, it really annoys them. And then they remember that's like not really an emotion, like that's
Right.
sort of an emotion, but it's like not
It's
always
not
how they're feeling.
descriptive. Right.
There's like more there. But yeah, I mean, you have to push a little bit more. It's nicer if you can see like when someone's talking about something that they're like, something else changes and it's not just words, I think.
Right, right. Well, and it's also a little bit different for you because you don't, you as a psychiatrist, you don't see patients the same way a therapist does, right? I kind of
Just
want to,
yeah,
yeah, I want to make that
tell that
distinction. Yes, yeah.
distinction.
Sorry, yeah,
Yeah, so it's complicated. So there are so many words and so many different types of mental health providers. So I will try to clarify. So the word therapist is used like very, very loosely and can mean lots of different people. So that can mean like something from a master's level, like in master's in counseling, to somebody who has a PhD and does therapy with their PhD, to a psychiatrist who has training and went to medical school. So, like, we can do therapy, and there are definitely psychiatrists who have practices where they do medication and do therapy, or actually just do therapy, because that's what they liked about medical school and training, and then that's what they kept doing.
right.
A lot of times, though, because of honestly need, right? So just sort of pure numbers, like, we there are not enough of the people who can prescribe medication, and so we get pulled to be the people prescribing medication. We get told that that's what we need to be doing in a lot of settings. So we end up prescribing medication in a lot of settings. So like in a college health setting, like
Right.
I could be doing therapy, but I'm really a lot more help if I was doing medication, because they need someone to be doing medication, right? And so I'm doing mostly meds. Yeah. I mean, we all do like supportive therapy and meds. Like, I would never, I'm not a person, I mean, it's absolutely outrageous to think, I mean, there are definitely people that do, but that to think you can do medication in a bubble without the rest.
Right.
You
Right.
know, so
Right.
you have to ask about the rest of the stuff, and you have to understand that like anything that's going on in someone's life is going to affect whether you would adjust a medication, whether you would change a medication. And if something's going on in someone's life, like, you have to be talking about that instead of adjusting a medication. So if something's coming up that is like therapy related, I'll do that instead, or I'll do a technique if I have to, because that makes sense. But it's not like the primary purpose of what I'm doing is not like a work through psychotherapy kind of thing, but I'm trained in it enough. Like, I did like full on CB, like cognitive behavioral therapy training, full on like had psychodynamic cases, and like did open like therapy training in that way. So like I can do it. It's just not what my caseload looks like right now.
Interesting. Interesting. That explains a lot, actually, specifically about my college psychiatrist, because she is the only psychiatrist that I have ever seen to this day that would take time to, first of all, we had full 30-minute appointments, like full. Every psychiatrist and like prescribing doctor that I have seen since then takes maybe 15, especially if it's a follow-up appointment. Like, are you fine? Are you not fine? Okay, you're not fine. Why? If you're fine, okay, here's the script for the next 3 months. Bye. So, but my college psychiatrist was very thorough, and she would ask me the same questions. I remember being, obviously because I was in college, so annoyed with the fact that I had to repeat myself after talking to my therapist separately. But wow, this is like 10 years later and I'm making these connections. So congratulations to me, I guess.
Yeah, I mean, I think I would say, I mean, based on my friends, I think the younger generation of psychiatrists is also really interested in the like psychotherapeutic connections and stuff. And so hopefully you're not going to see so many people that are just like pushing you through and really just trying to focus on meds. Like, I think we're interested in medication and we went into medical school, so we're doctors first and foremost, right?
Right.
So the medication part is like what we do, and we will ask you about medical stuff, and like that is what we do. And if we're in a hospital, it's going to be a very different setting than if we're an outpatient like I am, right? So if
Right.
you're in a psychiatric unit, that's going to be different. Or if you're getting seen by a psych provider in a medical floor because you have like a different medical diagnosis, that's also going to be a different setup too, right?
Right.
Just kind of different mindset, different interactions. Honestly, it just kind of is. But like someone like me is going to probably be a little more on the psychotherapeutic side of things because it's like we have the time and why not?
Understood. Understood. Neat. Okay. Well, I dig that and I appreciate that. And I think that's also going to help me in the future when I look for an appropriate doctor, I think to ask the right questions. Interesting. Interesting. Everything is interesting, obviously. I'm trying to pull my best Spock, but instead of saying fascinating, I'm doing interesting. That's today's theme. All right. So in terms of healthcare, like, do you feel, on one hand, I feel like it's amazing because more people have access to telehealth. Right? Is that true, or is that just like a misconception that we kind of like, oh, anybody can turn on Zoom, but like, are more people actually getting therapy? Because more people are definitely anxious right now.
More people are anxious. I don't know. I mean, I think the numbers like it depends on who's reporting. I mean, a lot of these
Sure.
like apps and companies say that they have higher usages, right? I think like if you like ask like Talkspace or something,
Sure.
they would say that they have higher usages. I think those apps are complicated because they're businesses and it's hard to know exactly from there. I think you know, there's a huge disparity when it comes to use too, because you have to have internet access and you have to have a computer or a tablet or some way to get um, be able to see a screen, right? So I think that's something that's not talked about enough, which is that yes, like it definitely does decrease the like location barrier and the travel
Right.
barrier and the and like maybe a little bit of the barrier if you didn't have a provider in your city. But if you can't afford internet access or pay for minutes or have a computer or a tablet, you're still not going to get care, right?
Right.
And in
Right.
a pandemic when people are losing their jobs and prioritizing other things, like maybe you're not paying your internet bill, maybe you're not paying your phone bill, maybe you're not going to pay for mental health on top of it too, right? So I
Right.
think that's still an issue, for sure.
Right.
And I think it's like an issue that's not talked about because people are just like telehealth is everywhere and like let's just spread telehealth. And
Sure.
I think it's very helpful and it's definitely something that we need to keep talking about. But I do think when we're talking about it, we have to think about like what would it be like to also consider providing like universal Wi-Fi? Like why is that not in the conversation? Like, okay, so we want people to have access to care, great, but how cheap is it to just give the Wi-Fi in all the cities? Like that seems
Right.
like not so bad. We
Right.
really don't want to spend money on healthcare in this country, yes, but I think Wi-Fi can't be as expensive as changing the entire healthcare system. So I think there's just things that are not in the conversation which like should be. But I do think in general, like it is accessible. Um, I think it's been an interesting couple months in terms of just like people. I think at the beginning, people were sort of like not coming in because I think people were really focused on food, clothing, shelter, lower rung Maslow hierarchy of needs stuff. So like I need to be safe. I need to take care of myself. I need to make sure that like I am not getting ill physically and I'm not going to think about my mental health. And that included like people with pre-existing mental health conditions. Like, I mean, it wasn't really like even my anxious patients weren't anxious, right? Um, and then I think the longer it's gone on, it's been like more and more people kind of coming back, either
Right.
for regular appointments or to be like, this is going on a while. Like I'm over it now. You know, like
Right.
now it's starting to bother me, or new people coming in being like, you know, I'm now I think like you know my partner or my friend or somebody says that like I'm not acting like myself, and I think they're right, and now I really do need help, and it's like it's turning a little bit more into that because it's gotten to that point, but I think it took people a bit, which makes sense, and I think um I think it's always going to be like that. Identifying symptoms in ourselves is like always takes it a while. But I think also the adrenaline is sort of like the like, oh my gosh, there's a pandemic. Like, oh my gosh, I have to be
Right.
safe. Like, oh my gosh, I need to take care of everybody. And then actually settle is hard.
Yeah. Yeah. Uh, I have also heard it said that there's been kind of two thoughts that I've heard. One is that more people just in general have anxiety because pandemic, like that's scary thing. So people are anxious over it, and it's a reasonable thing. And then there's another separate piece that people who live with anxiety are either also freaking out or like I got this. Everything is chaos and I'm always nervous anyway. And now that the whole world's catching up with me, I'm actually feeling pretty good and then like on level. Have you found that to be the case at all?
Yes, both. So, I mean, I think a couple of things. So, like, anxiety is, for the most part, like, comes from uncertainty, right? So, it's like preyed on by uncertainty. It evolutionarily evolved because we wanted to be able to predict threat, right? So,
Yeah.
like, there's an animal that we're trying to run from, and we need to know that it's there or it might be there. And so we have like a threat detector in our brain that says
Right.
like run or maybe run. And
Right.
someone with an anxiety disorder says run all the time or maybe run all the time, right? So they just have like a faulty detector, right?
Oh
Um,
my God, I'm gonna use that so often. I'm gonna be like, oh my God, my detector's going off.
Right. So they just have like it just like it fires, it
Right.
misfires, right? They
Right.
like see cues when they don't need cues and it misfires, right? And so if there's a lot of uncertainty in the world, then it's like very hard. It's like preying on that because you're like, there's like what do you mean? Like I don't know if I'm safe. I can't tell if I'm safe. And so your detector, which if you have an anxiety disorder is already lower, is then gonna be like, ooh, wait a second. And so I think that some people were either exceptionally triggered by that because it's like everything's uncertain.
Right.
I don't know where I am. Or they sort of felt like that actually like brought down the baseline, which
Right.
is to say, like, huh, well, I guess everybody's just gonna now my fears are realistic
Right.
because everybody thinks everything's uncertain. So now I can check myself. And so it's sort of like a almost like what was like a when what was like almost like a cognitive thing where they would be like, actually my fear is out of proportion to what was going on. Now
Right.
it's actually in proportion.
It's kind of like
So
validating it. It's kind of saying
yeah,
like, "Oh, I was valid to be this anxious over this thing and now everybody else is on the same level." So like my anxiety isn't totally out of nowhere here.
yeah. And
Yeah.
I think it's sort of like, I mean, they learned like, and they learned so many, like, especially if they'd gone to therapy before, or especially if they'd been in treatment before, have so many like coping skills around it that like
Yeah.
all of those skills are the skills that we're trying to teach people on the fly, right? For managing stress in a pandemic or managing uncertainty in a pandemic or managing any of this stuff. So they're like, well, like breathe, right? Or like deal with it. Like they
Yeah,
know all
yeah.
this stuff. Like you have a bigger arsenal, honestly,
Right.
right? Like you
Yeah.
might get triggered a little bit easier or whatever, but you like kind of have like a way to kick up your arsenal better than someone who has nothing in it, right? So
Yeah.
I do think it was kind of mixed. I think it's still kind of mixed. I think there are people who will all be in appointments like just regular sort of 6 month year follow up kind of thing. So they're like, like I'm fine. I don't know why I'm fine, but I'm fine. I'm fine. I don't need to change meds. And then there's people that are just like, but I don't, yeah, I'm not doing well.
Yeah.
And I think it's kind of a mix. But I think that the data that all these studies are coming, like these kind of like data that come out that have these like headlines that are like, everybody's anxious. I
Right.
mean, if somebody called you and they said, like, are you like regularly having excessive worry? Like, you're gonna say yes. It's a horrible screening tool, right? So
Yeah.
like they're using what we use as like the PHQ-2 and the GAD-2, which are like
Right.
two
Right.
questions to ask, like basically nothing, which are both based on just like, are you really, really worried right now? Like, literally everyone would say yes. Like, I
Right.
think if you don't, I don't know what's wrong with you, honestly. Like, even these people who are basically tolerating it and enjoying it would still say they're really worried. So, for the most part, everybody's screening positive. So, when they do these like studies, even the CDC data, it looks like they're like, everybody's really anxious and like depressed right now. But I don't know that like you can really look at that data correctly and say like that's diagnosable or like whatever. I think you just have to say like the baseline's like flipped on its head, and we have to reevaluate like what we're looking at.
So you would, so what you're saying, and I'm trying to translate it for myself, is if like those kinds of criteria are meant to be for people in normal peacetime, right? Like you wouldn't call people during a war or during a pandemic and be like, "Hey, you feeling nervous all the time?" And like, yes, I can't not feel nervous, but the level for the threshold for anxiety and having diagnosable anxiety is higher because there's a normal level of worry that you should have because your life literally is being threatened. So there is concern, and it's almost like, well, if you don't have that baseline, something's like that's wrong. You probably should be a little concerned, a little bit worried. Because if you're not and you're not wearing a mask, like we need to have a conversation because you should be worried about those things. Yeah.
Right,
So
but it's not like we have data that says like this is the pandemic baseline level and you're above
right,
that, right?
right,
So like, that's the problem, which is then you like how do you interpret that? I have the same problem in my office. Like I pretty much daily have a conversation which is like, I don't know if I should change your medicine. Um, I'm
yeah,
not sure if your anxiety is out of proportion to normal reaction to a
yeah,
pandemic,
yeah,
or if you like if adjusting your medicine makes a difference right now. But if it's really bothering you and like really affecting your life, we can try it. Like that's sort
right.
of where I've been, which is like if it's been a couple weeks, it's really affecting you and you want to try it, cool. Like that's where I'm at because I don't know. Like a lot of it's like, I mean, the stressor's not going away. You're
Right.
still in the like stressor. So that's still going to be there. And I mean, I don't know that like I can really 100% say like that's your brain doing it. Like I don't know.
That's really interesting because I've been debate. So I don't see my therapist like on a regular interval anymore. I see her as needed now, and that meter has been so off because so I moved, and moving is a huge life event, right? So anytime I was stressed over, like I'd be like, oh, it's probably because I'm moving. I don't know that I need to go talk to her. Like I just need to calm down, use all my coping skills, and understand that like I'm under a lot of stress because I'm moving. And I feel like it's been the same thing with my anxiety and my depression where like I'll get really bummed out and then I'm like, well, normally like I'm an extroverted person like you, and I need to see people to recharge, and I don't get to see people. Like this is not exactly the same. This does a lot for me, definitely, but it's not exactly the same. Like hanging out with my friends on Friday nights over a camera where somebody doesn't even turn on their camera, they're just over voice, like that's all totally different to me. So if I notice that like, hey, I'm feeling a little bit more depressive, like I might catch myself and be like, well, I don't know that I like need to talk to my therapist about it because she'd probably say, when's the last time you talked to somebody in person? No wonder you're like, maybe try to find like go out and go to the grocery store, like be around people so you have that feel. So I know what on one hand, I've been in therapy for so many years and I know what my tools are. But on the other hand, I do feel like, again, that baseline is so shifted and off to the side that it's definitely been more of a like, I think I got this. Am I supposed to be getting this? And like anybody you turn to, like I interview professionals, mental health professionals once a week. And anybody I turn to that I'm like, is this what we're supposed to be doing? And everybody's like, could be, probably. Does it work for you? Okay, great. Do that. So
it's really, we're doing a really good job, like making you think we know what we're doing.
So, well, somebody has to know what they're doing or give me the illusion that they do. Cause like, come on, somebody right now, there's not anybody who knows. Like people who do are lying. People who are like, I got this pandemic thing down. I just like, I don't believe you. I'm really sorry. If you say you figured it out, like I've figured out my basic living, like my needs. I figured out, like, again, my threshold for when I'm like anxious, and then when I'm just like pandemic anxious. I figured those things out, but I wouldn't say I like got a handle on it. And like, I can't because I like sat down. One of the normal exercises that I do when I start freaking out about the future is I sit down and I write like a plan for the next 2 weeks even. And I can't do that right now. You can't. You can. It's kind of a useless exercise right now because you don't know what's going to happen in the next 2 weeks. Are numbers going to spike? Are they going to drop? Are you going to be able to see your friends? Are you going to be able to eat out? Can't you eat out? Like all of that. But yeah, so that you got me ranting. There you go.
No, I mean, it's really hard, like, especially right at the beginning when we were like all having to stay inside, like our coping skills are like thrown out the window.
Yeah. Yeah. But like at the same time, I've definitely been more actively using my coping skills than I ever would because there is that omnipresent, there's a pandemic. So if I'm anxious, I'm able to say, oh, it's probably because I can't control this thing, or I haven't seen my friends, or I'm worried about my husband's health. Like I can pinpoint it more. Whereas normally anxiety for me was this like super vague thing. Like I'm just anxious. Why are you anxious? I don't know. It's just nervousness. It's just there. So on one hand, like maybe, yeah, like all your tools are out the window, but at the same time you're like using them. Does that make sense? Does that make sense at all?
So.
Okay.
What do the people listening think?
That's a great, yeah, you guys, what do you think? I would love to know. Have you been kind of adjusting and getting used to all of this? Do you feel like this is actually a great time to open everything for Q&A? Exclamation.
Look what I just did. I just took over your show.
Oh, I took over my own show when I stopped listening to you and started just ranting on about my own anxiety.
I just threw it to your audience.
You're fine. This is perfect. This is how the show is supposed to run, and people who watch it regularly will tell you that like these are the more fun episodes where both people are actively participating.
Like, what's your audience think? And you're like, good point.
That's a great, yeah. She has flipped the table. It's true. I keep asking myself if we tripped and fell into a weird sci-fi movie. I feel that a lot. I will go to grocery stores and I'll see people wearing a mask and I'm like, that's not like, I'm totally fine. And I'll like zone out and kind of just be like, where's the salami? Oh, I gotta go get the milk. And then I'll see somebody.
I keep calling.
What?
I keep calling the like our baseline now is like the upside down.
Oh, like Stranger Things? Mm-hmm. God. I prefer the alternate timeline, like we're in the bad timeline. We just have to get back to the regular one. I like that too. Oh man. I got used to that, although it gets harder the longer it goes. Oh, that's interesting. Because I would think that for me, it's gotten easier the longer. It's become something more in the background rather than, I don't know. But yeah. Do you feel like it's gotten harder or easier for you, Dr. Gold?
I think it changes. So okay. I change my mind all the time. Like sometimes I'm like, this is really like an easy week. And sometimes I'm like, I'm really over it and I'd like it to be over. And I think it really depends on how optimistic I am that things will change anytime soon. And I think it depends on how optimistic I am about getting to travel anytime soon. So I think that I feel like, I think that that's a big thing for me. So like, not that I like travel all the time, but I think like my family is not here. So like my family is all in like Florida or Boston. And I moved from California before I came here. I was like, that's my life. That's what that is. And so like, I mean, I want to not be here all the time, right?
Right.
So like I think that's a big thing for me, which is like
Yeah.
I like things to look forward to. And
Yes.
so like
And
I think
traveling
that
is
it's
that thing. Yeah.
yeah, and so it doesn't matter if what I'm looking forward to is in March. So like it doesn't have to be tomorrow. So I think that's what's interesting to me is like my mindset doesn't actually have to say like it's tomorrow, like I'm going away tomorrow. Like it just has to be like, oh, like I have a fun vacation planned with friends, but it's like
Same,
in
same. That like
January,
keeps
right?
me, that's what keeps me moving. Like, oh, it's gonna be so great when we go, even if it's just like a week. It's that it's gonna be
Right.
great. Like all this is worth it when I get
Yeah.
that week off.
In
Totally.
January, right? But it's
Yes.
like it doesn't have to be now, but it's
Yeah.
like it's so long from now. I don't
It's
know
yeah.
when. Like
I
that's
don't know when
like
at
that's
all.
that's the thing I don't like, I think.
Yeah. Oh, I get yeah. Because we had all these plans that like for our 30th. So it my husband and I are born the same year, and for our 30th birthday, we were gonna go to London. Like that was the plan, and so we kind of like it was really cute. My sister came over and spoke in a terrible British accent for like 30 minutes. She's like, "You wanted to go to London? I brought you London here." Because it was such a it's such a like, oh, it's one thing to say to put it off and be like, oh yeah, you know what, we'll go on our 30th birthday. And it's another thing to be like, I don't know when we'll go now, like at all, if ever. I don't know what traveling is gonna be like even, a week from now. Yeah. Yeah. All right, let's see what the audience says. I have a 93-year-old grandparent, so I've been following as much advice as possible since the start: gloves, masks, and social distancing. I feel it's very much continue to embrace the suck. Keep the classic British stiff upper lip and keep soldiering on, really. If I go to the store,
Embrace the suck is good.
embrace the
I should
suck.
make shirts that say embrace the suck.
Well, I think you're going to have to pay this person. It's Cyber Squirrel 84 if
You should make shirts that say that, Cyber Squirrel.
Bliffle Slick says, I go to the store and people aren't wearing a mask. I feel like I'm from another world until I see someone else with a mask. Oh, where you're like that weird out of body experience where you're like, wait, should I not? Is this over? Like, should I not be wearing this? Oh, okay. No, I'm doing the right thing. That guy's doing it too. Okay. I get that.
I mostly feel like I'm going to get punched in the face or something, and that's not helpful.
Wait, why do you not wear a mask? Why are you going to
No,
get punched?
of course I do. I'm like I mean,
right,
because
you're like a doctor.
Politically. I mean,
Yeah.
I think that stuff is just like, I mean, I'm very like pro science, obviously.
I hope
And I
so.
think that I live in like a place that, I mean, this stuff has become very messy, and there's things that I think are science and not politics. And I very much don't talk about politics because I think that I see whoever comes to my
Right.
office, and I live in a very red state, and I will
Yep.
talk about whatever. I want people to feel safe coming to see me.
Right.
But
Right.
ultimately, these things are facts. And if we would have done some of this stuff, we would be fine by now.
Yeah.
And I can't, like, this kind of stuff in my state is a big issue, right? I'm in Missouri. And we have, I think people forget Missouri is like probably top four worst of these like governors. Like our governor and our senator, it was like, they named like four senators that were the favorites. Our senator is like one of the favorite not listeners. Like, I mean, I think it's hard when you're like that, because then people want to go back to school and they want to do everything and not listen. And Missouri was the place where you saw the pictures from the Ozarks, which is here. All the pictures of the people on the lake. And
Yeah.
I think, I mean, it's just, I grew up in Florida, which is also in the news for really great stuff. So I'm just I'm surrounded by like kind of states that end up in the news for really great things. But I think for me, it's mostly just like this concept of like, I believe in science, but I think it is really hard
Right.
to
It
like
blows
go
my
outside
mind.
and not feel like I'm gonna get like, I don't know, like
Yeah.
punched in the face or something.
Because you're doing the right thing. It blows my mind that it's a political discussion. Like I did not I honestly, there's a lot of things I didn't see coming, but I really did not see that coming, that wearing a mask would become a political statement. That I was like, I figured some jerks would not be on board just because they're not comfortable, but I didn't think it would become a statement of like, well, where like, I don't know what even kind of state, it's become a statement. It's become a like, well, I don't believe in this stuff with pride. And I was like, since when are we proud of not believing in science? How is that a thing? That's not supposed to be a thing. What the heck? What the heck?
Yeah, it's really hard. I mean, I think that's really hard for sure. But I
Yeah.
think that, yeah, that's my opinion.
Yeah. That's your professional opinion. I understand that I live in Oklahoma and our governor caught COVID-19. It's a very red state, so masks are politicized among Republicans. It's so stupid.
I mean, it's
Hi.
hard. I mean, I have patients that'll say, like, I'm not wearing a mask because of my politics and stuff. And, like, I am a
And
neutral
you sit there and you're
provider.
like, mm-hmm.
I, I mean, I say things like, it sounds like it's really hard for you when people tell you what to do, like,
Yeah.
but it's very hard for me to sit there and I'll say, like, it sounds like there are arguments for why that might be good for your health.
It sounds like some people might
It's
know
like,
because
but it's
yeah.
really hard, like,
Yeah.
to sit there. I mean, but it's probably, I wouldn't have that if I was like a provider somewhere else, right? So I
Yeah.
think it's a very interesting thing. But I probably have half my patients are like that. So I think if I had a practice in person, I probably would be at risk, to be honest.
Wow, that sucks. Like that's the bottom line. That sucks. Okay, so embrace the suck is what started this discussion. I love
Yeah,
it.
I
I
want
love
to
it.
embrace this. I want a shirt that says that.
It does amaze me the amount of people who, quite frankly, whinge at the mask, not doing anything to protect them, absorbed in their own selfishness. The mask doesn't protect you from others. The point is it protects others from you. Right. Right. Every time I feel like I start to manage it, something else pops up. I think I've reached a point where I'm just compartmentalizing and I need to manage the now and deal with feelings later, but it's so unintentional where you just kind of plow through because you're like, yeah, there's a pandemic, whatever. I gotta do other stuff. I don't know. I get that.
I think that a lot of people cope by doing, right? I'm a
Yeah.
cope by doer.
Yes.
I write on overdrive. I mean, I get made fun of all the time for that. Like, I definitely, like, Hamilton, write like I'm running out of time, right? So, like, I mean, advocacy is like a very easy thing to throw yourself into when
Yes.
you're feeling stressed out or when
Yeah.
you're feeling like the world's kind of messy because you're like helping. And so,
Yeah.
like, and that's an actual, like, defense mechanism that's healthy, right? And so,
Yeah.
but it can become to the point that it can feel unhealthy because you can
Yeah.
end up kind of not stopping and going, like, I'm actually not dealing with the fact that this is hard, like, I'm just doing, and,
Yeah.
like, I'm just helping other people and doing a lot for other people, but I haven't really stopped and gone, like, how is this affecting my life, or how is this affecting, like, my work and my day, because I'm just doing so much. And I mean, I definitely do that, and I think a lot of my friends do too.
I feel called out. Like it's not okay. I literally, when it started back in March, we did the Upliftathon, which was a telethon benefiting mental health charities. And I wrote 2 articles and I made 2 YouTube videos dedicated to like how to cope with COVID. And then I remember I released like a Twitter video and I was like, I don't know that I'm doing this right, but it's like this is all I know how to do. I want to fix something and I can't fix it. So I'm going to hopefully like what I did is I like researched a bunch of ways that it could help me and then I made videos and wrote about that. So like that was my coping, but at the same time I don't think I stopped to be like how do I actually feel about this? I think I was just like what do I do? I do this thing. I do this. Okay, this is the thing. We do. But I don't know how productive it was. Like I don't know. Interesting. Uh Unfortunately, I can't. Oh, sorry. Go ahead.
No, I mean, I'm honest about that stuff because it's definitely like one of my productive, unproductive defense mechanisms.
I like that productive, unproductive. Yeah. Yes. I understand that I live in Oklahoma. Yes. Okay. I enjoy branches of science, especially physics. Unfortunately, I can't claim the phrase "embrace the suck." I learned it from a U.S. Army colleague. Got it. Got it. I understand that I live in. Okay, wait. I'm reading that comment the third time.
You really, really want to read that comment.
I really want to read that comment. It's a scary reality. Live in Oklahoma and sit and go. Okay, wait. I can't read that one. Okay. Bless you for being able to do that, Dr. Gold. You are awesome for being able to talk to patients who refuse to wear masks. It's to be like It's interesting that you should do that. How do I tell you you're wrong without straight up making you leave? Because I want to tell you you're dumb. That's my immediate reaction. But like, you went to a lot of years of school to teach you how to not say you're dumb and you shouldn't do that. Because I
I
imagine,
don't feel like people are dumb. I
yeah,
really like at the core, like, I mean, and I'll tell you, this is honest, right? I think that people have um things that are preyed on. And I feel
yeah,
like this about young people. I feel very defensive about young people all the time. I feel like young people get a really bad reputation for things like not caring and going out and
sure,
drinking and just
sure,
like partying and not caring at all about the pandemic, but nobody spoke to them. Nobody told them that this mattered to them.
yeah,
Like nobody for a long, long time, like people just told them they were healthy and like it didn't matter. So like if they went out like and didn't have grandparents and didn't have parents, like they just thought they were fine, right? And so
right,
then all of a sudden they started getting sick and nobody told them about it. And then nobody talked to them. And then they started like putting pictures of them and making fun of them and telling them they didn't care, right? Or they were depressed because they have high rates of depression and loneliness. And then they went out because that felt good and that was better for them than being at home. And the risk was lower to be out, right? Like, I don't know. I think that there's reasons behind a lot of this stuff behaviorally and like mentally, and I think that like people in charge are not doing their jobs to help with it, but do actually prey on these like easily like psychologic weaknesses in people. And so I actually have a lot of empathy for it. So I can sit with a lot of things because I have a lot of empathy for where it's coming from. And like I could be completely honest with that, like politically, like or not. Like I mean, it's hard to like engage if they weren't my patient, I bet like they'd fight me. You know what I mean? Like which is different. Like I think when you're on social media or when you're in
sure.
person, like I think, like it's hard to like a lot of these like kinds of people like we have a lot more divide because we can't have these conversations and people don't want to have these kind of conversations where you try to bridge divides and try to understand where people are coming from because you can't even get past the initial conversation. I kind of can luck out because like they're not that I have to sit and listen to it. Like I'm not going to fight it and they're not going to fight me. And so it allows me to be a little bit more like have a little more in and a little more empathy and like a little different viewpoint. But I do think like, I mean, I do have like a little different perspective on that because I feel pretty empathetic about the way that people's minds are preyed on.
Well, don't I feel ashamed for calling people dumb? But
No,
no,
I don't
seriously.
think they're dumb. I just, I mean, I don't
No,
think
I
that's
called them
wrong.
dumb. I'm
No,
saying I wasn't.
I don't think it's wrong. I think that it's like complicated, right? I think
Yeah,
it's
no,
like
it is.
it
Yeah.
like it's super complicated and we just like I think that people just don't have a chance. I mean, maybe some I mean, I wouldn't doubt that some people are, but I think that like there probably is a group that aren't.
Yeah. I mean, but that's a really, really good reminder because I preach that a lot. Like, hey, you don't know why people are doing this or that. But when you, like, I get so angry about the mask thing, like, so angry, I can't see past that. I'm like, how dare you be this so selfish and, not social distance, not wear a mask, like, not want to wear a mask? Like, how could you think of the social good so little? But taking that moment to be like, well, why wouldn't, like, what would be a stronger motivator, right? Because it has to outweigh, the positives have to outweigh for you. So what would be the stronger motivator? Like staying healthy, what you perceive that you may or may not stay healthy wearing this mask, or like you said, like socializing because you're depressed and you literally, if you don't see other people, you are going to like crumple into a little ball. So yeah, which one outweighs it for you? And then it's just from there on, it's a lot easier to understand people. I like
I
that.
also think science is like confusing and it's easy to no, I do. I think that
Yeah.
it's easy to prey on science communication. So like I think that we aren't very good communicators like organically, like no one taught scientists to talk and nobody taught doctors to talk.
Yeah.
But people taught politicians to talk
Yep.
and people taught lawyers to talk. And so we're like trying to explain really complex things
Right.
against people against which shouldn't be against people who like can spin and can convey things in a different way. And so I think
That's
like
a
we're
really
just
good point.
not as good at talking. And so I think I think science is confusing. Like, what does it mean to flatten the curve? It
Right.
never meant stop the disease,
Right.
right? It meant extend it.
Right.
The problem was nobody understood that flattening meant it was still going on, right? So I think there was like this perspective that
Right.
flattening was like a pancake where it stopped it, right? And so if we went inside, it deflated the tire and like it was
That's it.
gone.
Yeah.
Poof. Like we went inside, it was gone. But the problem was like that was a tail. It just
Right.
like flattened it, like made it longer, like until we could get a treatment. That's what it was doing. But
Right.
that whole part was like because they were making pictures and like trying to convey it. Nobody listened to that part. Like
Yeah.
nobody heard that part, and so
Well,
nobody like people
that
missed like that you have to wait for a vaccine and that this was going to be a while. Like people were like, "Oh, I go inside for a month and this is over." Like they just didn't hear that, you know? And I think it's just super fascinating. Science is very easy to just manipulate because it's confusing and because it changes. And that is infuriating to
that
me
is infuriating.
because
Yeah.
we don't know what we're doing. And
Right.
that is infuriating, right? So
Right.
we don't know what we're doing. You know how fast we're figuring this out? Like in
It's
actuality,
wild. It is
it's wild.
wild. Like this
But
should take like 6 years.
but
But
they're not getting any credit for it
right.
because they like didn't figure it out in a month and people are dying, right? And
Yeah.
they are figuring out stuff in like months instead of years, which is
Right.
like wild. But
Right.
they're not getting credit for it because they said one thing and then they changed their mind. But they didn't really change their mind.
They didn't
Science
change their
changed,
mind. They just
right?
know more. They know
Right.
better now than they used to. Right.
But that's the problem because it's so easy to say, like, well, they said that thing in January and then they changed their mind in March, but they didn't change their mind. Science changed. And so I think that that's like, again, like, it's just so easy to take science and like make science the bad guy. And that's so frustrating for me, but so frustrating when you're like at home and you're like, why won't someone wear a mask? Well, because they you can take it and say, but they said don't wear them
Right.
in January.
They did say that. They did.
Yeah,
I
because they were
remember.
trying to
Yeah.
protect the healthcare workers. They
Right.
framed it wrong.
Yeah. Yeah.
They
But
should
that's
have always said that. They should have
I
always said that they were
right.
trying to protect the healthcare workers. It was framed wrong. Like they
Yeah.
didn't have enough masks. We still don't have enough masks. They should have said we didn't have enough masks for healthcare workers. We need you to make masks. We need to make masks. Go make cloth masks. We need the N95s for healthcare workers. Period.
But
That would have made sense.
you nailed it on the head with the whole like the reason is because we never were like nobody took the time to explain like to teach scientists how to explain this stuff. We have some really good like leading scientists that like even Bill Nye, like science communicators, right? Bill Nye and Neil deGrasse Tyson and heck and you. So and I sorry I said heck, I mean and you. But seriously, like we have some people, but I feel like that the logicness does not outweigh is not louder than the fear mongering. And that's the issue. Is if you have the right tools, right? It's the difference between, and I don't want to start an argument about this, but it's the difference between somebody saying pro-life versus pro-choice, right? Because pro-life sounds really powerful. It sounds like how could you be against that? Versus pro-choice sounds very like, yeah, I'm pro people's ability to choose stuff, but I'm mostly pro not killing people. So it's all in the verbiage and being able to present it properly. And the wrong people maybe have the right manipulative tools. I don't really know.
It's really complicated, and I think that like if like my friends are really good science communicators and on TV and they get bumped from CNN for a person who is not telling the truth, then that's a
Yeah.
problem,
Yeah.
right? Like if you're going to bump them being on the TV and telling you the truth and you're going to play somebody on TV saying really, really bad false stuff and then you're going to say, "Oh, that was false." Well, it doesn't matter. You already played it. Like
Right.
you bumped the person who knew what they were talking about for the false stuff. It doesn't matter if then you say it was false. You already played it. Like, so it's really messy, like how the press, like it doesn't matter, like that they think it's fun or funny or whatever. Like they don't do a good job. Like
Yeah.
it's like the way, So I mean, they bump good science communicators up TV all the time for the drama.
Yeah. Well, and
Oh,
somebody put it really well. There, it's for the drama. I don't know if it was in chat yesterday or in an article that I was reading, but it's basically the news is depressing because they say there's a 70% chance of rain, not there's a 30% chance there won't be rain, right? So, and if we're constantly favoring that kind of attitude and that kind of, then we're not going to get the positive aspect of it. That's not what you're going to hear. If the first thing you always hear is the negative part of it, that's all your brain is taking in. It stopped listening because then it's in fear mode and it's in anxiety mode and it's in all these other, survival, survival things that we've acquired in order to try to prevent things like that happening. So that's, oh man, you hit the nail on the head. I love this. Let's crap on the media. This is good.
it's just a, it's a different angle with understanding the psychological components of it. But I'm also like a pretty big proponent of like why educating physicians and healthcare providers
Right.
on talking, because I mean, I think, if anything, COVID especially has really taught us that we need a cadre of like activatable science communicators. I mean, we have a decent, I mean, I'm shocked at the amount of, I mean, they're mostly my friends, but we have a pretty activatable group of people who know how to do this, but nobody taught them. They just
Yeah.
figured it out
Yeah.
because they tried and failed and heard what worked and didn't work and learned and whatever, right? But nobody taught me. I just talked, and somebody thought that made sense, and so I kept talking, right? Like somebody encouraged me to write, and I kept writing, right? And I think
Yeah.
that's what happens. But I think for the most part, like you also, a lot of people might be good at this, but are scared or whatever. Like
Yeah.
somebody scared them away from it. A lot of medicine is like this is unprofessional or this isn't valued or this is not
Yes.
like whatever. So like if you would spend there, if this was something that was prioritized in medicine training or like and it was up there with like doing research or whatever, and like it was something that it was valued to the same degree, we would have awesome people doing both research in this stuff but also like showing up when we need them
Yeah.
and running for office and all this sort of stuff, because they would already know how to do it. Like
Right.
they would be trained in it, they would have had experience in it, and they would value it, and it would be up there. Like advocacy should be like a pillar of the profession, plain and simple.
Yeah. Awesome. Do you guys have any questions before we have to let Dr. Gold
Yeah.
go? Please.
Give me some questions.
Exclamation letter Q. Give them to her. She needs them. She requires them for nourishment, substance. Please.
Yeah,
Please
some
help.
questions.
Exclamation letter Q. But I mean, we've kind of answered a lot. So I could see people being like, nah, you got it.
They're like, she just went on a rant about like, I don't know, communication. We're confused by her.
No, I don't think they're confused by you. I think they've gotten like all the information they want out of it. Do you have any catos or doggos? Just me, Andrea asks. Oh boy.
Yeah, you want to see her? She's sleeping. Want
Of
to see her?
course. Well, I don't know if we want to wake her up, but
No,
I
she's
can
right
go
here.
for it.
Okay,
Okay.
come here. Hold on.
Okay. We are being given a cato or a doggo.
Dog.
I'm actually not doggo.
Oh no,
okay.
she's running away from me.
Oh no, she doesn't want to be on camera.
Yeah,
My
she
doggo
does.
doesn't like being on camera either.
Yes, she does.
Oh my
Here.
gosh, it's so small. It's so small and so frustrated at being caught. Oh my goodness. Hi. No, she's like, no, stop. I don't wanna. No, mom. Aww.
This is Winnie.
Hi, Winnie. She's like, no, help, please help.
She's fine. She's super spoiled, so she's fine.
Oh my god, she's like a parrot though. She's just like sitting on your shoulder now.
This is, you woke me up, I'm going back to sleep.
Yeah, she's like, great, now you have to hold me while I sleep. I hope you enjoy that. Good for you. Yeah, she can feel all of us looking. Oh my gosh, if you guys seriously don't have any questions for Dr. Gold, I'm hella impressed. Thank you. She's already she's done. She's like, all right, well, I've done everything I'm supposed to do.
Winnie, you have nothing to say? She's like, I'm over it. Look at, she's like,
yeah,
she's camera
pissed. She looks
She's
pissed from
not
behind.
super pissed. Look
No,
at, like, you say hi and not be a jerk. No,
no.
she's super
She's
tired
just
or something.
tired. She's a
She's
sleepy
like, I'm,
baby. Yeah, excuse me. Excuse me. Hold me while I sleep. Which is like, isn't that what all of us want? Like, if we're completely honest with ourselves. Yeah, I think both of us have done a great job covering the topics. Dak, I totally agree. I think that's why there's not really a lot of questions. I think we just like we did a good job with the talking, so there's no question queuing.
we did all the talking, and my dog's worn out too.
Yeah, it's Listen, all my viewers must be exhausted just from listening to all. So I appreciate all of you being here. Thank you so much. I am going to. All right, so here is. Oh, I gotta learn how to press buttons. Interview links. There you go. So there is Dr. Jessi Gold on Twitter, and that is the best way to find everything that she does. From right, correct? Yes. And she's no longer banned from Twitter, so that's like great. Yeah, so find everything she does there, including her
I
writing.
have a website too.
Oh, is the website linked off of Twitter?
Yeah, I think so. It's just drjessigold.com.
Oh, okay. There you go. drjessigold.com. Okay, so if there are no further questions, I will let you go, but I want to make sure, like, do you have anything to plug? Is there anything that you want to make sure that you talk about?
Not really.
No.
I just do this stuff for fun.
I love that you do it for fun, because I'm going to have you on like all the time. Be like, I need a 15-minute rant on the following. Please help.
Yeah, I don't have anything to plug. I just come and hang out.
I love it. No, this is great. This is what we like doing, is hanging out. And these conversations, again, when they're like two-sided like this, they go a lot better than when it's just me going like, and then what? And then the person's like, I don't really feel like talking. And you're like, great, I'm so happy to have you on my show.
Well, they seem fun.
Yeah, this hasn't happened often. I'm being silly, but thank you so much for being here. I appreciate you so much, everybody. After this brief break, we're going to be right back, and I love you all, and thank you so much, Dr. Jessi Gold. I appreciate it.